Yesterday,
European countries have suspended the use of the AstraZeneca vaccine. Are you concerned about this, and should we be following suit?
No, I took advice again this morning. As you know, I'm acting health minister as well as Prime Minister for the next few days, from Professor Murphy, and no, that is not the view of our medical advisors. And TGA obviously looks at these reports when they come through, but they do their own batch testing, as I was visiting just this week, on the batches that are made available and are going out across Australia. There's some 300,000 doses that are already out and being distributed from AstraZeneca, and there's another 400,000 which are about to go out. Now, that, of course, is a lot less than what we'd anticipated of international supply in these early phases. We'd anticipated that to be around 3.8 million. Now, that obviously has an impact on the amount of doses available in these early stages of the rollout, and that is, as Professor Murphy said yesterday, that has an obvious impact on the early stage rollout. But the fact is, we should be at around 150,000 doses administered by the end of this week. We said many months ago, in fact about a month ago in particular, that we would hope to get in those early phases to around 80,000 a week. Now we are getting up to those levels now as we conclude our third week. The other point I'd make about vaccines, given you've raised the topic, and I note the response to what was in evidence given yesterday by Professor Murphy. This is not news. The Health Minister made it very clear on the 16th of February. I was standing right next to him, as was Professor John Skerritt, in the courtyard in Canberra, where we made it very clear that the change in the advice that the second dose being received after 12 weeks rather than 4 weeks meant that the second dose having been received for AstraZeneca by the end of October wouldn't be possible. That was made very clear by the Health Minister a month ago. So that isn't new information. It's important that as we continue to update, that it's important to stay up to date on where the goalposts are on this. And so that was not a surprise yesterday, certainly not to me. That was what we'd advised the country a month ago. But as the vaccination rolls out, as another 1,000 GPs come into this system over the next week and the weeks ahead, ramping up to more than 4,000, that army of dose administrators will be significant, and we will get to the point also with the rollout of the domestically produced vaccines from AstraZeneca out of Melbourne, and that will really enable us to ramp up.
Prime Minister, yesterday Brendan Murphy said the first dose...
Showgrounds, football stadiums, car parks or perhaps raceways be used to help utilise and boost the rollout of vaccines?
Well, the vaccine strategy worked up particularly for these early phases. We're not talking about the balance of the population in these early weeks. We're talking about 82-year-olds in aged care facilities. We're talking about healthcare workers. We're talking about those who are working in quarantine, and we're making great progress through the state-based arrangements for those workers, and we've given additional doses, particularly here in New South Wales, because they carry the major load of the quarantine system here in Australia. And they're working steadfastly through that, and here in New South Wales they're making great progress on that. Our priority at this time is getting into those aged care areas, and about a quarter or thereabouts of the total amount we've been able to vaccinate so far. I think it's about 380 facilities, just over that we've already been able to reach. So we're not going to pick people up out of aged care homes, put them on buses and take them to stadiums. That's not the right thing to do. That's not the care way to administer these vaccines in these early phases. We'll also be going out into Indigenous communities very soon. And those 400,000 AstraZeneca, which obviously don't have to be stored at sub 71 degrees, that gives us the opportunity to be reaching out into those Indigenous communities. And so we need to go there rather than bringing them to where we are. Now, as we go on, we'll continue to work closely with the states. The GP system will have up to about 5,000 GPs involved in this process, and a handful compared to 5,000. I was advised this morning around about only 30 have decided they don't want to participate. Thousands are saying they're going to be involved in this. They do it with flu jabs every year. And so they're involved with that rollout. We do millions upon millions of these vaccinations on flus every year. This is a specific type of vaccine, and that's the primary method through which we're administering that system. And the states have their systems as well, which we're boosting as well. There's the GP respiratory clinics as well, which is a larger system for administering these doses. And so that's the right plan for Australia. We're not in the situation that the United Kingdom is, or Italy, where 300 people are dying a day. That's not the crisis situation that we find ourselves in. So we can do it in this orderly way and do it in a way where we can provide the appropriate care, particularly the most vulnerable, those who are disabled and those who are aged.
So,